Hi, this is Dr. Hadley Thurman from Alpine Creek Dental. I wanted to touch base and kind of go over teeth whitening. Teeth whitening was actually discovered when periodontal patients were having therapy and they were wearing trays with hydrogen peroxide in them to help destroy the microbes in the pockets around their diseased teeth. These patients were actually getting whiter teeth as a side effect, so that's how they kind of realize peroxide can help whiten teeth. So we have pores in our teeth, and the peroxide, it's either a hydrogen peroxide or a carbonide peroxide solution, will actually open the pores in the teeth and go in and whiten the intrinsic part of the tooth. And it works well. The one side effect is sometimes people can have a little sensitivity because we are opening those pores in the teeth. The good thing is we can combat that with fluoride, there's sensitivity toothpaste, or the means of whitening. So there are 3 different modes or methods of whitening. There's either over-the-counter whitening, where you can actually buy a kit either at Walgreens or Target or the grocery store, and that's typically a less than 10% solution. And there's stickers that usually go from your canine tooth to your canine tooth, or your fang to your fang. And it's a good start to whitening. Truthfully, I don't see a lot of significant difference when people use the over-the-counter whitening, but if you're interested, I wouldn't discourage anyone. It's a good try. The second mode of whitening is actually take-home trays, where we can take impressions of your teeth or scan impressions of your teeth and have these little plastic trays custom made for you. And then we can actually put the bleach in the tray, and you would wear that tray 30 minutes to an hour once or twice a day. And a whitening takes about 2 weeks, 7 to 14 days. And then after that time period of whitening, when you feel like you've gotten to the, as white as you are content with or happy with, or your saturation point, for a 3rd week, you would just, it's called following the white t-shirt rule. So that's your stabilization period, where the pores in the teeth kind of close, and the shade can still change slightly until it's stabilized. The white t-shirt rule is a good way to basically anything that could stain a white t-shirt, you should avoid while you're whitening, because the pores in the teeth are open. And so if you're drinking red wine or coffee or tea, it's kind of counteracting that bleach that's trying to lighten your tooth. It's not going to turn your tooth red or brown, but it sort of defeats the purpose. So the 3rd mode of whitening, there is actually in-office whitening that is available as well. It's certainly instant gratification. It's a little more time consuming on the front end, but it's another option available. We do have, it's called the Epic Diode Laser, which is great. And so we can even offer whitening with the Epic Diode in the office. And if someone has a wedding coming up or a graduation or something, and they don't have the luxury of 3 or 4 weeks, it's another alternative to whiten your teeth. I will say I personally have whitened a number of times through my life. I was fortunate or unfortunate to have a couple childhood injuries, and so I actually have a crown on a front tooth and a veneer on another tooth, and so I've whitened my teeth, chose a shade, and had that dentistry done. And so now if my teeth start to fade a little bit, I just touch up the whitening to make sure they match the dentistry that I have in my mouth. Another good thing to do if you're whitening, or even if you're trying to keep your teeth white, is just after meals, swish with water. It just neutralizes any acids in your mouth, and helps protect and sort of remineralize your enamel. If you're interested, especially after this COVID-19 shelter at home is lifted, and you're looking for something to kind of brighten your day, teeth whitening would be a nice option, I think, a good treat to yourself. So our office is available, 630-941-9299. So let's try that again. 630-941-9299, or you can contact us at info@alpinecreekdental.com. Look for the green awnings. We're here for you. We hope you stay healthy and safe. And until then, take care.